Hi, I'm Rick, Vice President of Operations with Heritage Victor Valley Medical Group. I'd like to quickly talk about Medicare Advantage and how it all fits together. I recommend you watch Medicare Alphabet Soup prior to this video to help you better understand what I'm about to speak on. Part C is Medicare Advantage, and that is when you turn in your regular Medicare benefits and choose a Medicare Advantage health plan. Let me talk about the hierarchy of contracting and how it fits together. CMS, which is Center for Medicare and Medicaid, or the federal government, is at the top. They contract with various health plans, and the health plans contract with medical groups. The medical group contracts with your actual physicians or your other medical providers. Oftentimes, people understand they choose a primary care physician when they choose a health plan. And what's lost in the translation is how they got assigned to this medical group. So you can see through the hierarchy of contracting, it kind of happens to you transparently. So I chose Dr. Jones, and I chose XYZ Health Plan. How did I get assigned to this medical group? A medical group can actually bring an additional layer of benefits into the picture for you as well as a beneficiary. Things such as health education, maybe it's social activities, or a gym membership, or other things that a medical group assignment might bring to you, in addition to all of the benefits that are brought to you by your health plan. Now, one of the best things about a Medicare Advantage health plan is they're regulated by the federal government to have at least the minimum amount of benefits that Medicare offers or more. So you will not lose any benefits in choosing a Medicare Advantage plan. Typically, you will experience more benefits. This is how you end up with things under your coverage such as vision benefits or dental benefits or other items that Medicare, straight Medicare, does not include. Pharmacy is a big one, or your Part D as in drug benefit. Part A, your inpatient benefits, those all come with a Medicare Advantage plan. Part B, all of your outpatient services come with a Medicare Advantage plan. And Part D, a drug benefit, comes with a Medicare Advantage plan. So I call it government math. A plus B plus D equals Part C, which is a Medicare Advantage plan. And it's true for all of these plans. And I know you'll receive a lot of correspondence or you'll see a lot of TV commercials from a number of health plans during what's called annual enrollment period each year, which goes from October 15th through December the 7th. Now, the premise in all Medicare Advantage plans is you choose that primary care physician. Typically, we used to call that your family doctor. So it's not your specialist, not your cardiologist, but somebody who's a general practitioner or a family practitioner, and that's who coordinates all of your care under the Medicare Advantage health plan. One of the things that you'll hear a lot about are stars and star ratings. I'd like to define what that is pretty quickly. Sounds like kind of a Yelp rating, right? Well, star rating is kind of like that, from 1 to 5, 5 being the best. And you'll see it a lot on the TV ads that you find. What it's really talking about, though, is not specifically the rating of the plan, but we have these things called measures that we all have to adhere to. So think of that hierarchy of contracting. You'll have a star rating for each health plan, you'll have a star rating for every medical group, and even down to your physician could have a star rating. What the rating is about preventative services. So they're kind of population defined denominators is what we'd call them if you go back to your math days. Say we have a population of females in a certain age group that all should have a mammogram each year or every other year. And so they determine how many out of that defined population actually had the test. Diabetes is a big area that we have measures on. You know, there are about 4 or 5 measures specific to diabetics. Did you have a hemoglobin A1C test during the year? And you are a diabetic, so you're in that denominator population, and the numerator is how many of those people had the test. I caution people about these are preventative services, and isn't really the most important part probably what did they do with you at the medical group level or your physician once they determined you had this disease state versus simply running the test, which is what the star rating is on. So I use caution and using star ratings as a choosing factor or a choosing determinant when you're picking a health plan, but I want you to know what that's about because it does indicate how well they interact with their beneficiaries and if you're getting in and doing the tests that you should have every year or every other year, depending upon the measure. So be good consumers of healthcare this year. Shop around, attend a meeting. Open enrollment meetings are really prevalent this time of year. Our group at Heritage Victor Valley Medical Group, we put on 28 meetings during the year, 2 different types of meetings. One is a kind that's just specific for one health plan. So you're only going to hear the benefits available to you under that one plan. The one we do the most often, though, is one with a broker, because a broker can present more than one plan to you at a time, and you can do, as a consumer, a side-by-side comparison of what all of the various out-of-pocket costs are to you under each of those specific health plans, and make the best choice possible for you in the coming year. So again, be great consumers of healthcare, educate yourself, and don't be afraid to ask a lot of questions.